But there is a query that there is adherence to the skin. Merely adherence to the skin doesn't meet with the criteria of ulcer, edema or satellite nodule. So adherence doesn't mean that it is a what? T4B. So a 42-year-old presenting with a lump of 3 into 4.8 with adherence to the skin and matted axillary lymph nodes. On USG, the size was found to be 3.2 into 5.2 with few acoustic internal memories. Lymph nodes. What is the TNM? Students try to understand. You know that T1 is equal to less than equal to 2 centimeter. T2 is more than 2 up to 5. T3 is more than 5 centimeter, and T4 is any size with invasion into the skin or chest wall. So into the chest wall it is T4A, but remember P major is not a part of this. Then second is T4B. Remember it is into the skin and it includes the word ulcer, it includes the word edema, or if edema is not there, PUD orange. Or in the remotest case, we have the third thing as satellite nodules. So these are the three things that we have. Then we have T4C. When we talk about T4C, what is that, students? It is into the chest wall, and along with that chest wall into the skin. And then we have T4D. What do you mean by T4D? It is inflammatory cancer. So along with this, N is also important. N1 is defined as mobile level 1, level 2 axillary lymph nodes. N2 is defined as N2A, that is fixed level 1, level 2 axillary lymph nodes. And N2B is defined as ipsilateral internal memory lymph nodes. N3 is defined as N3A into level 3 axillary lymph nodes, that is infraclavicular. N3B is defined as, it's a combination of N2A plus N2B. That means if both the internal memory and the axillary lymph nodes are present. In N3C, ipsilateral supraclavicular lymph node. So if you see in this question, the higher size is 5.2, so the staging goes to T3. But there is a query that there is adherence to the skin. Merely adherence to the skin doesn't meet with the criteria of ulcer, edema or satellite nodule. So adherence doesn't mean that it is a what? T4B. So answer will stand in category of T3. Now axillary lymph nodes are present on clinical examination and they are matted, that is N2A. And then on ultrasound, few internal acoustic lymph nodes. So that means it is a combination of N2A plus N2B. So it's N3B. So T3, N3B, M0 is the answer for this question.
Subscribe and press the bell icon so you never miss an update from PrepLadder.